and I'll be the moderator for this session. In observation of World Kidney Day, Mohammed bin Rashid University of Medicine and Health Sciences, Dubai Healthcare City, Al Jalila Children's Specialty Hospital, Mediclinic City Hospital, and Al Jalila Foundation came together to create the Think Kidney campaign, launched to raise awareness around kidney disease, organ donation, and transplantation. Today, and as part of the Think Kidney campaign, we have an amazing panel of speakers who will discuss firsthand how organ donation can save lives. Let me start by introducing Prithvik Sinha DC, Dubai's first recipient of a pediatric kidney transplant from a live donor, his father Bhaskar Sinha. Prithvik is a Dubai college student and an advocate for organ donation in the UAE. Also with us today is Mr. Bhaskar Sinha, who has given his son Prithvik the gift of life through donating his kidney. In addition, our panel includes the transplant surgeons who led the team that operated on Prithvik in Al Jalila Children's and Mr. Bhaskar in Mediclinic City Hospital. Dr. Waldo Concepcion is the head of the Organ Transplant Center in Al Jalila Children's Hospital. He was also previously the Chief of Clinical and Pediatric Kidney Transplantation at Stanford University Hospital and Clinics in the USA. Last but not the least, we have with us Dr. Farhad Janahi, a transplant surgeon, consultant urologist, and assistant professor of surgery at MBRU. Before we start our session, I would like to remind you that we will be taking questions at the end of the session. Please use the chat box to type in your questions, which I'll be reading at the end. So as we move forward with the session, my first question is for Prithvik. So Prithvik, could you tell us about your life before you received the kidney transplant? What does it feel like to live with kidney failure?
Thank you. So good afternoon, everyone. So basically, my life before kidney failure, I was born with several tags, so to speak, that I've heard many tags thrown at me: world's youngest author in paleontology, nerd, gifted, autistic, crazy, so on. And those heavy burdens of tags progressed as I became a teenager, a Dubai college student, and was declared a world science scholar, the first one from the Middle East and Africa. And I managed to bag a Future Star Award. However, a secret tag that many never knew was the one that I was born with, the tag of a progressive renal failure patient. And so what exactly did that mean to me, you ask? It means kind of an unwanted warrant. It's a warrant that stopped me from eating my favorite food, sushi, or playing tennis, or worse, enduring excruciating pain in my joints, bulldozing headaches, a feeling of nonstop nausea, itching, and many more. However, I just managed to somehow live with all of these. I was still managing to do my work to the best of my abilities, and I was still just a stage 4 renal failure patient. But then it became a lot worse in 2020, when, of course, COVID struck and froze the world. My dad lost his job, my mother her business, and my insurance backed off. And if things couldn't be worse, my kidneys at that time completely failed. I went from stage 4 to stage 5. And so there was an enormous economics of treating an end-stage renal failure patient, and it had a massive burden on my parents. And I could see my overtly strong mom succumbing to fear. My dad was in tears. My grandparents fell sick. But, then as they say, don't give up on hope. There has to be a miracle. And that happened. His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and Prime Minister of the UAE, penned me a letter, called me a warrior, and assured me that I'm in safe hands, and the country that's nurtured me, throughout my life will continue to do so, and is actually my home. And I can visualize the tears in my parents' eyes, actually, when Al Jalila Foundation stepped in and pledged to fund my treatment, to ensure that I could pursue my dreams unhindered. And my dialysis began, and I was slowly put on the wait list for a deceased donor. And the last thing I'll say in regards to this, was that dialysis was, yet another story. So, it was like I was hooked up to a machine for 5 hours at a stretch twice every single week, and I could really see myself and my work sinking. Now, the dialysis team were brilliant under Dr. Martin, Dr. Samir at Al Jalila Children's Hospital. They were amazing. They truly tried to make me as happy as possible. However, there was increasing pain, extreme fatigue, and exhaustion. And worse, there was no sight of a deceased donor. And so it was decided that my dad, who was already being prepared by Mediclinic City Hospital, would become a live donor. And that was that. But, the thing is, I think it's a story of why we really do need deceased donation in this country to avoid the kind of difficulties of dialysis and avoid the kind of difficulties of live donation even, because, I am a kidney failure patient, but I do understand there are many other people who might not be able to afford such treatments, who might not have the opportunity to pay for them, or who might find it even more difficult than I did at dialysis, with even stronger medical problems. So that's what I kind of wanted to get across today.
Thank you, Prithvik. And I think it goes beyond saying how inspiring and how miraculous this story is to all of our audience members today. And seeing this as a way of inspiring others, as a role model in the world of kidney donation, is really what we stand for. And we're really happy that we could hear your side as someone who went through kidney failure and as someone who saw the hope of receiving a kidney, and on top of that, the support of Al Jalila Children's, Mediclinic City Hospital, and the government of the UAE. So moving forward, really, my next question from a more medical standpoint goes to Dr. Farhad Janahi. Dr. Farhad, scientifically speaking, what happens when a person suffers from kidney failure? I'm curious to know of how it would work from your perspective as a surgeon and a doctor. If we can have you unmuted, Dr. Farhad. Thank you.
Thank you, Faisal. So kidney has it does many functions. Okay, one of the main function is to excrete the waste and the toxins of the body. Also, it regulates blood pressure. It regulates the fluids inside the body. It helps with the production of blood, red blood cells, and also regulating vitamin D, which has a great impact on bones. Unfortunately, when someone's kidney function deteriorates, a person doesn't have any symptoms until it is late. As Prithvik mentioned, so we have different type of kidney failure. We have stage 1, stage 2, stage 3, stage 4, and then stage 5. Stage 5, we call it end stage kidney disease. And at that point, a patient has to be on something called renal replacement. They don't have any kidney function, or we say below 10, below 15%, that this patient needs some support. If they don't get support, that it's not compatible with life. In case of kidney, we have the option of dialysis, or that person needs to get a kidney transplant. So most people, their kidney function deteriorating, and they wouldn't know. There is no symptoms until it goes to stage 4 and stage 5, where they may experience some swelling of their limbs, okay, reduced production of urine, feeling lethargy, and in case of children, their growth is limited. So these are the symptoms when it is stage 4 or stage 5.
Right. Thank you for describing this, Dr. Farhad. And I think it helps us understand why kidneys are important and what would happen to an otherwise healthy and normal person if their kidneys were to fail. And then this makes me really wonder how and what services do we have here in the country for such patients who are undergoing the process of, well, kidney failure and the need for kidney support.
Okay, so just I want to add, so kidney failure, as I said, people who are stage 5 or end-stage kidney disease, they have option of dialysis, or kidney transplantation. Dialysis does only 10–15% function of a kidney, so it just get rid of the waste and some of the fluids, but it doesn't regulate the blood pressure, it doesn't regulate vitamin D, and it doesn't help with blood production. So really, there is no comparison between dialysis and kidney transplantation. And as you know, usually most people who are on dialysis, they have to be dialyzed about 3 times a week, each time for 4 hours. So it's time consuming. Patient feel very tired, and a person cannot go on dialysis forever. They have problem with the line, with the way that dialysis is connected to their body. So eventually they run out of dialysis basically, and they need to be transplanted. In this country, in the UAE, anyone who has kidney failure will be referred to one of the centers that have dialysis, that they can support them. And then the dialysis center, their nephrologist, the kidney doctor, will refer them to one of the transplant centers in the country. In Dubai, we have Mediclinic City Hospital for adults, a Dubai Hospital for adults, and Al Jalila Children Hospital for children.
Well, thank you again. And this is interesting because we now understand the options available for such patients. And at the same time, we do have dialysis, we do have transplantation. However, dialysis is not the solution from what I've understood. And this only means that transplantation and organ donation is where our focus needs to be at. So thank you for describing that for us, Dr. Farhad. And looking at now from a more donor perspective, and this question is directed towards Mr. Bhaskar, who is Prithvik's dad and the live donor for this initiative. Mr. Bhaskar, you have donated one of your kidneys to your son. Was that an easy decision to make? And what was going through your mind during this time?
Good afternoon, everyone. Yeah, thank you for bringing me in. Actually, 3 factors, to tell you the truth, 3 factors actually prompted me to take this decision. Number one is is a moral obligation. Being a parent, means it is our moral obligation to see our son or our posterity should thrive, to attain all their success, their everything in life. But when I saw my son, or our son actually, there is also another unsung hero, my wife. When we saw, she did massive anyway. So when we saw in front of our eyes that our son is sinking, and so it is our moral obligation that he should not sink. So that is factor number 1. Factor number 2 is actually scientific. If we study a bit, about kidney, how kidneys functions, and the person's kidneys and all, though God has given us 2 kidneys, but 1 kidney or a part of a healthy kidney is sufficient enough, good enough, so that we can carry our lifestyle, best if we are healthy or if we remain in healthy lifestyle. Touch wood, before this operation, I had never known any health complications. Thankfully, maybe that's the reason I was selected. So that is, a scientific factor. And the third factor, and the last but not the least, means we saw in front of our own eyes that how my son was, having deteriorated health conditions. Okay, he explained, briefly in the, introductory remark. Yes, it was very, very painful, extremely painful. But when, as a dad, I can say, as a son or as a student, he have given his 200%. Whatever boxes are there, he delivered everywhere. He is till now only one, world science scholar from this MENA region, and he is still not gone to university, still in the school, and he is an affiliated researcher of the Beyond Center for Fundamental Research in Arizona State University. So, so it is our moral obligation, not only from parents, I think from the society also, that he should pursue his passion. Like his another passion is, he is the UAE ambassador for organ donation. And actually he wants, and actually he convinced not only us to the doctors and all, that he really want to take up that issue, that disease donation, because instead this disease donation means, see, we are actually wasting the body, means, you know, there are almost thousands of, you know, critical patients almost in UAE, whatever the latest statistics. Ms. Najud can tell about more than 4,500 critical care they are waiting for the organ transplants, you know. And a person can save actually 8 lives. You know, means, okay, we have God given 2 kidneys, but you know there is only 1 heart, there is only 1 liver. So it means, so there is, instead of, you know, cremating the body, instead of, you know, sending the body to the grave, you know, if possible, the doctors are there, specialists are there, those organs can be utilized, and actually, you know, their relatives can see that their loved ones are actually getting new lives, new lease of life through this disease donation. So only this, mainly these 3 factors actually prompted me to go for this. Thank you.
Thank you, Mr. Bhaskar. And I think this speaks a lot for the respect we have and the moral obligation that you mentioned, both as family members in your perspective and as community members, as a society, to stand up for organ donation and really make sure that no child, no bright mind out there has to ever suffer with the consequences of kidney failure. So thank you for talking about that. And that really brings me to the point of the surgery and the transplant process from your side, Mr. Bhaskar. Did you have any doubts before the surgery, and how did you clear these doubts from your side?
Frankly speaking, I actually, even my near and dear ones, they asked me about this. I don't want to hide that. But when we have blessings from His Highness Sheikh Mohammed bin Rashid Al Maktoum, and when all these wonderful doctors, stalwarts in their fields, Dr. Farad, Dr. Waldo, actually, as well as, you know, Al Jalila Foundation, Al Jalila Children's Medical Hospital, Medical University Hospital, as well as MBRU, and you know, not the least, you know, Dubai Health Authority under the, you know, patronage of His Highness. When all these bright hands are together, I never had any iota of any suspicion. You know, the doctors, the nurses. Actually, I'm really thankful that you know, I've been, you know, got care in wonderfully in you know, Medical Clinic City Hospital. I'm really thankful. Their services, the nurses, you know, like mother, they treated me, and definitely doctors are very wonderful. I never doubted their abilities.
Thank you, Dr. Bhaskar. And I think, again, we have a moment here to share about how blessed we are as a country to have facilities that allow safe and protected transplantation procedures, donation under specialists and experts from all around the world. So thank you for bringing that point. And now that we've heard from both the son and the father as donors and recipients in this story, I'd like to move our focus towards the medical side of this, and this is where I believe Dr. Waldo would be able to guide us. Dr. Waldo, as a transplant surgeon yourself, can you tell us more about kidney transplantation and how does it work from a surgeon's point of view?
Well, thank you for the opportunity to participate today. I think that this event is such a wonderful event, mostly because we want to start a new culture in the UAE and Dubai about a society and a culture that cares about people. That's what it's all about. We are just providers and the facilitators of this great grave of life. Before I start, I just want to say that Bhaskar, you see them there, very humble, but he's a hero, because the fact of giving his kidney to save the life of his son, he's saving the life of somebody else, because the kidney will go from deceased donor to Prithvik, now it's going to another person. And that's why we should have a culture of honor and respect for donors, because they really make a difference in somebody's life. Going back to the process for donation, whenever we evaluated the recipient, like Prithvik or any other one, we first find out what the state of health is of the donor or the recipient, and be sure that that we know everything about it, be sure that the conditions are doing well, and most important is that they're suitable for transplantation. And after that, we have a conversation about what's the process of getting a kidney transplant. We educate about the two routes. One is for to disease donor, that is a person that has to have a brain dead, and then from there allocate the organs, or living donation. Living donation for us means a lot, first of all, because it's an effort of a family, of friends, or relatives that want to give life to a patient, in this case, Prithvik. But also, we want to be sure that as much as we want to help Prithvik, is that the donor, that will be this time Bhaskar, is safe. That is our most important aspect. He's completely healthy, and want to be sure that through all this process, both sides are safe. Obviously, a living donation, it's a lot more preferred, mostly because you can schedule it. It's the best quality of donor because the donor is healthy. And third, you can make it in proximity, diminishing the time from the donation to transplantation. After this, we proceeded to do all the tests on the donor, be sure that they have good function, and most important, they have good residual function to be able to have a normal life. Then from there on, after all that, then we go with the cross-matching to ensure that the cells and the serum accept each other, both the recipient and donor accept each other, and from there we schedule the surgery. So, sorry, getting interruption here, but from there on, we schedule the surgery, we admit both donor and recipient at the hospital, and we start the surgery probably early in the morning, about 8 o'clock. This is a team effort, so Dr. Farhad and Sheena and Dr. Hemant, all of us work together. So we go to the donor first, position, and we do what they call the open technique. Due to the fact that it's the first one in the UAE on a pediatric patient, we want to be 100% safe. So we did a incision to the side of the abdomen. We carefully move all the tissues around the kidney until it's ready to be removed. We give a medication to prevent any clotting and remove the kidney, and Dr. Farhad proceeded to place on preservation solution that will be ready to be transported and implanted on Prithvik. From there, we go to the recipient surgery, and then Prithvik, by that time, will have all the IVs, put on general anesthesia, and then in the right side of the lower abdomen, we do an incision in which the artery and vein that goes to the leg, we implant it there, and then the ureter, when it's working well, the kidney, we implant it to the bladder. The total surgery for each side is 3 hours each one, probably 3-4 hours, and so in a period of 8 hours, probably we can be sure that from beginning to end will be done. From there on, goes to the care of the team, the nephrology, the intensivists, and everything to care for both sides. I think that's pretty much a synopsis of the donor and the recipient surgery.
Thank you, Dr. Waldo, and for taking us through this journey from a surgeon's perspective. Hopefully helps our audience members visualize and understand what it takes to really bring this expertise in terms of the transplantation process.
Thank you.
And this really, I think, now that we have had the patient's perspective from a donor, from a recipient's, and even a surgeon and the urology perspective, I think it's important to go back to Prithvik here and really ask Prithvik about the letter that you'd received earlier. And then you'd received a letter from His Highness Sheikh Mohammed bin Rashid Al Maktoum to show his support to you, Prithvik. And your life had dramatically changed after this transplant as well. So if you could tell us a bit about how your life changed and the support that you received from this letter, that would be great.
So, thank you. Yeah, a kidney transplant is, I mean, it's definitely a rebirth, but that rebirth just contains several clauses, especially like a cauldron of immunosuppressants that can cause havoc with your body. And that's exactly what Dr. Martin was facing. A permutation and combination of the right dose became a nightmare. and I landed up becoming highly diabetic, having a very high blood pressure and swelling and an undefined fatigue. But despite many sleepless nights and many fistfights with the doctors, Dr. Martin did finally manage to get things almost under control. And so we are working together on that. So I think it's important to know that once a kidney transplant ends, it's not like the final stage. There are still constant checkups on someone's health throughout that entire process. So it's a very extended process, definitely. But I think throughout the process, I hoped that I got the best out of the gift that I not only received from His Highness in that letter, but also from my dad, that the kidney that he gave to me. On that letter, it was, as I said, it was a life-changing event almost. It was incredibly wonderful to hear that I was supported because of my work and my research to actually get the support needed to do this kidney transplant and get treatment for this chronic condition. And, you know, today I would like to give back to this nation, to give back to the UAE, not just by using my knowledge or my research to make this nation a hub for scientific innovation and exploration, but also to ensure that we as a country can nurture our talents, even those who are suffering from chronic health issues that are not in their control, as Dr. Farhad and Dr. Waldo said, by providing a methodology for getting them a treatment, deceased transplantation, or support that they need, basically. And so that's kind of what I learned from His Highness and the letter that he gave me, that I really do want to give back to the country, and that's the biggest impact that it had on me.
Thank you for sharing this, Prithvik. And if anything, you are a true ambassador for the UAE, not just for the work that you've done as a young, bright mind, but also in the world and the field of organ and kidney donation. And as part of the Think Kidney campaign, you've given us a new face and led this wonderfully. So thank you for your time. And again, as we move forward with this panel discussion, I'd like to remind our audience members that you are more than welcome to ask questions in the chat box to our panelists, who are more than happy to answer any of them. Now, moving forward to Mr. Bhaskar's perspective here as a donor. Mr. Bhaskar, one of the myths of kidney donation is that the donor's health is greatly impacted following the donation surgery. Did this surgery impact your health in any way? And if you could give us a bit of a perspective from your side after the surgery, how you felt.
Okay, just to start with, from the last answer, when you are surrounded by some amazing doctors, clever doctors, I don't think you have any issue. Actually, I was told that you will be, get up from the bed and you can able to walk within 3 days. That's actually true. Very, very true. Yes. And what what they say that, means you'll be normal, absolutely normal, very quickly. Okay. Actually, what I suggest now, that we should not, everything process, because after all, it's a major cut. Wound healing takes some time, but yes, but you will be absolutely fine. Within 15 days, I started my office work, though it is, computer-based and office-based. And within a month, I am at the site. Though you have to maintain certain, doctors, suggestions that no heavy lifting, not going up to the, scaffoldings and all. Yes, if you maintain these things, yeah, you'll be absolutely fine. Now only, I'm in the 3rd month running, and means I have no health issue, no health complications. And actually, in the morning I just get up like before. I go for a brisk walk, then come back, take shower, then have breakfast, then go to the office. Life is slowly coming back to the old cycle, old routine. Yes, we have to be a little bit careful about, because I was a little bit health freak. I used to jog, not jog, run, skip, and all these things in the morning. Those I have stopped for the time being. But given chance, probably Dr. Farhad or Dr. Waldo will allow me after 3 months, I'll be able to do all these things also. So, but otherwise, it's perfectly fine. The meat and all, I don't think there is any concern about this. And actually, it's not only me. Okay, I am the live example, but there are so many other examples available. Even I met few of them. in my home country, in other countries, people can lead a normal life with a single kidney throughout life. Means his life or her life won't be shortened by donating a kidney. That's for sure. Thank you for asking this question.
Thank you, Mr. Bhaskar. And Prithvik, if you'd like to add on to this, please.
Yes, thank you. I just wanted to add something for our listeners that, I don't know, from my story and from my father's story especially, that I think we're all trying to get across is that, yes, life is definitely a challenge, but every challenge brings with it like a new lesson, a lesson that teaches you resilience and perseverance and gives you a new tag, a tag to inspire, to do good for humankind. And never did I imagine, as my dad kind of said, that there could be anything more to be proud of than being an affiliated researcher at Beyond Center for Fundamental Concepts of Science, or a co-author of NASA's Astrobiology Primer at 15. And that too was just before my critical health crisis reached its zenith last year, with me becoming COVID positive. But by then, the campaign to encourage deceased donation had already started deep down in my heart. And my slogan is simple: donate organs to save lives. And I would like to collaborate and work with Al Jalila Foundation, Mohammed bin Rashid University of Medical and Health Sciences, and the Dubai government to reach out to every individual and motivate them to sign up on hayat.mohap.gov for deceased donation. I'd also like to appeal all those who are blessed with surplus to help Al Jalila Foundation fund and save many more lives like mine. And of course, let us all ensure that our loved ones do remain alive and we cherish their memories even after their deaths by donating their precious organs to those who otherwise won't ever make it. And so I guess we should all pledge to live today, to live life after death, and let's all pledge to donate our organs to save lives. So thank you again for giving me this opportunity to pour my heart out.
Thank you so much, Prithvik. And both Mr. Bhaskar and Prithvik, you've been excellent role models for us. And this is exactly why we're hosting and having campaigns like this, to have the donor and the recipient speak about their experiences, so that the community can understand and in a way break the stigma that we have around donating kidneys or organs. So these are words that are exceptionally true, and coming from both of you, it means a lot more. Thank you for that. And now moving to an exciting question towards Dr. Farhad here. And Dr. Farhad, under the MBRU organ transplant program, we've seen about 20 successful transplant surgeries taking place until today, in collaboration with both Mediclinic City Hospital and Al Jalila Children's. Can you tell us more about this program and what makes it so special?
Thank you, Faisal. So first of all, what makes us special? We are blessed to have a great team, well experienced, international experience, local experience. What's special about us is that our team, not only the surgeons and the physicians and the nurses, everyone who's involved from administrative side, we are all passionate, dedicated, and committed to do the best for our patients. And I really, not only I speak on my behalf, and I speak on behalf of my team, that when we see a patient, we are with them in the journey. They become part of us. They have our mobile number. They can call us at any time. This is before and after transplant surgery. So once they come to our waiting list, they become part of us. And we really give the best, and we treat them like our family. Okay, that is our family member who's in need. They have 24/7 access to almost everyone in the team, that they can pick up the phone. We have this problem because transplant is a journey. Before transplant, they're anxious. After transplantation, with immunosuppression, that they need a follow-up. And they don't see each time different person. They know the team. They know who to call. That's what it makes our team, our program, a very special program.
I absolutely agree with you, Dr. Farhad. And I think seeing this both as a medical student and as an advocate for organ donation, seeing this in the hospital, how the doctor and the patients are connected throughout this journey is so true and inspiring in all ways. So I think it makes a great system and a great team, and that benefits our patients at the end of the day. So thank you for leading such a team at Mediclinic City and at Al Jalila Children's as well. And if you could perhaps highlight a bit more, Dr. Farhad, about this transplant program and how it really works in terms of how you've managed 20 successful transplant surgeries in this time.
Okay, so the transplant program is under umbrella of the MBRU, Mohammed bin Rashid University of Medicine and Health Sciences, and we have we collaborate for children with Al Jalila Children's Hospital and for adults with Mediclinic City Hospital, and we work as a one team. We have committee that decide with different healthcare professional for a patient to go on the waiting list. There are many people involved, not only the transplant physician and surgeon and nurses. There are cardiologists, gastroenterologists. There are many doctors who are involved, and they contribute to our program. And we work really as one team for one purpose, and to make patients who have kidney failure to get a better outcome.
Right, absolutely. And that brings me to the question about the public and our audience members. How can they contribute to this program?
Thank you. So this is very important. As we can see, Prithvik is very lucky that he have his dad to be able to give him a kidney. Otherwise, Prithvik would have been on dialysis and has to wait for deceased donation. Bhaskar is really the hero. Not only he helped his son, to donate a kidney, he made sure that Prithvik comes out of the list, so that kidney, if when becomes available, can go to another person. My pledge is to everyone in the audience, please register to Hayat. This is where you can express your willingness to be a donor, just in case that you pass away. From our experience, people, the loved one who allow for their loved one organ to be donated if they pass away, they get sense of relief and consolation when they do this. So I would encourage everyone, there is no age limit, to become a donor, and it's not only to sign up, make sure you talk to your family, because once you are dead, then your family is going to decide to bring everyone and let them know of your decision. This can happen on a dinner table when they're having dinner, that this is what we can do. Unfortunately, we have many patients on the waiting list, and they're waiting for a long time in order to receive kidney. And kidneys, kidney failure patient, at least we have dialysis. We call dialysis as a bridge to transplantation, so they have time to get an organ. If a person has liver failure or heart failure or lung failure, they don't have that bridge. So they eventually, unfortunately, they pass away. And there are many potential donors that they could save those patients' life. So my pledge is, please make sure you sign up for Hayat and talk to your family, talk to your loved ones.
Beautifully said, Dr. Farhad. And I think this is one of our take-home messages from the panel discussion today for our audience members, that we're here working towards conversations like these to be normalized within our families, within our friends, be it at a dinner table, but to really talk about kidney donation and how we can give this gift of life to someone in need, knowing that there are so many patients on this waiting list, and seeing the happiness and how life-changing this can be, thanks to our examples here, Mr. Bhaskar and Prithvik. And going back to the Hayat app, which is our standard for registering for organ donation and kidney donation, please do have a look at Hayat app, and we're more than welcome to again assist you in any way possible in registration. My question now, as we move towards the end of the session, goes towards Dr. Waldo. And Dr. Waldo, an organ donor can save lives up to 8 people. And that's just amazes me, just the knowing this fact. And what comes to my mind is, what organs can be donated by someone if I am interested to donate?
I think the first one that we all should be thinking about it is donating blood. If you look at the UAE, it's a very significant shortage of blood some of the times. And you know that this is not just for transplant, for any surgery, critically ill patients, chemotherapy, oncology, everything, cardiothoracic, everything needs blood. And that's the most important organ that we need pretty much every day. I'm not saying that that is more important than other ones, but it's just so needed. From there on, the solid organs are very important in the sense that any patient that has any organ failure, be heart, lung, pancreas, kidneys, liver, are benefited by donation. But in the future, as we go along, we'll progress more. And we start talking about combination organs. We talk about heart, liver. We talk about liver, kidneys, kidney, pancreas, because this area, there's a significant amount of diabetes in which we're going to need to consider pancreas as a transplant procedure. In the area that we're going to progress in the future is tissue. Many patients are requiring skin, need also tendons, need cover of the brain. There are many other tissues that can benefit. And one that's extremely important that everybody will value will be the cornea. In this area and areas like here, Middle East, there's a significant amount of corneal diseases in which patients are blind. And just the cornea transplant will bring them life to them. They can see the world with their own eyes. So when we start looking at the possibilities, it's so immense what can be done just with a willing heart to save another human being. And I always like to say that organ donation and transplantation is probably the best expression of human nature. We can preach about a lot of religion, but the religion stays in words and the church. Organ transplantation, organ donation, you bring life to another person. That's religion put in practice. When we become that sensitive with a neighbor, with our other human being, forget about color, race, status, whatever it is, and we donate to alleviate and give life to the people, we become a better society. And that's what this meeting is all about, is that we make aware the organs are not sold, the organs are not go for business, it's just to save lives. It's all about saving lives of people through many different issues, through many different things. And most important is that when we become that giving society, we become the better society that we can be. And that's what we're all trying to do. It's not about just the transplant. It's about healing our society to have the best out of it, to express it to each other.
These are absolute words to live by, Dr. Waldo. And I think instilling these values of humanity could perhaps help us solve so many more problems in the world. And we appreciate how doctors and surgeons and advocates for organ donors all around the world are coming together to give a life to someone in need. And this is something I think our audience would love to take home today, that it only makes you more human to think of organ donation. Now, my question is now directed towards Prithvik. And Prithvik, as an advocate for organ donation, you've already shared so many parts of your story. Is there anything that you'd still like to share with the world, with our audience members, as someone who's received this gift of life?
Yeah, sure. So today, I guess, as the UAE ambassador for organ donation, I pledge, and I hope all of you can pledge as well in our audience today, with sincerity, to empower those on how each of us can save 8 lives, on how our organs can be used after death to save people, and how we, in essence, can live our lives even beyond death through someone else, and how the memories of loved ones can be preserved in this way, so that they're, in a way, they're not truly lost. And so signing up for deceased donation on Hayat, as has been mentioned, should be at least a moral obligation, that we are doing something incredibly positive for the world and something incredibly positive for humankind. And so that's my pledge as the UAE ambassador, and I hope all of you can take that pledge home today.
Thank you, Prithvik. And we really value advice, and you've shown us how we can save lives. And I think going back to the way how we can all register on the Hayat app is the first step towards making a difference. So we all stand by this pledge, and hopefully this session has changed the perspective, some thoughts, some ideas, some experiences for our audience members as well. And again, we'd like to thank everyone who attended this session. And I'd like to remind you to visit thinkkidney.ae to learn more about kidney disease, how to contribute, how our patients are part of the society, and how the transplant program works as well. So thinkkidney.ae is the place to go. And now we'll move towards the final part of this panel discussion, which is question and answers from the audience. So again, we encourage anyone who has questions to any of our speakers to use the chat box either on the Teams platform or YouTube Live. So we do have a question at the moment coming in from one of our YouTube audience members. And this question is from Padma. Padma's question is, how can we create awareness for organ donation as a teenager? Padma is interested in creating this awareness and learning new ways within at least her potential. And I think we can have any of our panelists to help her give ideas to this question. Perhaps starting from Prithvik.
So I think I can just give a brief idea, as I'm also a teenager in this, and I guess the main way would be try and work with the experts in this field, get in touch. So I got in touch, for instance, with Mohammed bin Rashid University of Health Sciences and with Al-Jalila Foundation, try and not only raise awareness, but start the process of raising funds for this process, for the kidney transplant process, as well as trying to get in touch with doctors and starting local as you can and building up from there. Like give talks or speeches on this in your school, and so that's one of the ways that I'd start off in this. And just if you have a story or someone and work together with that person and try and bring their story to the world, or bring your story to the world on how organ donation has impacted you, impacted someone you love, and how and get concrete goals on what exactly we can do, where people can sign up, how they can support, and start on the local level. So that's, I guess, my suggestion, to be honest.
Thank you, Prithvik. And as a teenager answering this question, it just brings it more, I think, value and having you come from a perspective of raising awareness around your school, university, research platforms, and fellow peers. I think I can add in that perhaps having these conversations to begin with within your friends and colleagues, like you mentioned, is the first step towards making a difference. If there's any other comment from any of our panelists, we're more than welcome to this question as well.
Yeah, this is very important. Also, we have to understand is that what we're trying to do is to ingrain this system for many years to come. And I think everything starts with education. I think teenagers that are interested in this could form a curriculum, X amount of curriculum for every, specifically middle grades, and integrate it into the curriculum once so often to talk about specific areas related with organ donation and stage organ. And at least in where I come from, that's what we started to do it as a whole, to different schools and different cities, and most important, start educating the community from early about this area of organ donation that is not that is not a miracle type of surgery, but it's as previously mentioned, it's a moral obligation to care for your neighbor. And another important area is that to educate people that this is not going from another country. These are needs that are local, from your neighbor, from your family, from the people that go to church to you, from the people that go to school. Maybe these are some of the people that are requiring on needing this life-saving transplant and making it to be real for the community. I'm just going to give you an example right now how I made this. I visited Israel, and in Israel, they started working the synagogue to say how many people there were needing. And then the community right there started working on live donation for these people. And to make the story short, every year they donate between 50 and 100 organs, kidney transplant on these communities. So it can be done. You just need to be aware that it's not something foreign, it's something right there in your backyard. Maybe you're even family. In my family already, 2 of my family have received kidney transplant. So it becomes real. And that's why I think that education, making everybody familiar with this, making this an event that, as you say, it's a moral obligation for us to get involved.
Wise words, Dr. Waldo. And this again, I think, brings us to the topic that we can all make a difference in some way at some level. This could mean at a school level, this could mean within a family, or within our communities. So it really comes down to keeping a wide open eye and making sure that we don't leave a potential idea to make a difference unturned. My next question, which is an exciting series of 2 questions, one for Prithvik and one for Dr. Farhad, is from Mr. Zakaria, who asks Prithvik, concerning your symptoms, burden and the self-management before kidney transplants, how did you manage extreme fatigue, and what professional support did you receive to manage your fatigue after your dialysis sessions? And how is your fatigue experience after kidney transplantation?
Sure. So mostly Al Jalila Children's Hospital and Mediclinic City Hospital had managed a lot of my conditions and a lot of my treatments. It was certainly difficult to manage fatigue and exhaustion and pain. I guess I tried my best by trying to will through it, because I kind of looked at what did I want to do with my life, my passions, what I was interested in research, and used that as a goal. I set 1 by 1 goals and tried to accomplish them, so that even throughout my fatigue, I could still get things done. But it was incredibly difficult, and I know many others might not have had that support system as I might have had. And so I would say this is why these discussions are really important, to get across the idea that we do need more support for renal transplant patients, for kidney transplant patients, and for transplant patients in general. And after dialysis and after kidney transplant, of course, it has been improving my fatigue and other issues. I mentioned that there's a big problem with kind of getting the dosage levels right in immunosuppressants. But yeah, that's been slowly stabilizing. And once that stabilizes over time, it slowly improves. And so that's really my situation now. And I hope it continues to improve without any further complications.
Thank you, Prithvik, and thank you again, Prithvik. And I think this is the insider information that we need as part of beyond just reading the websites and the books. So thank you for sharing that. Our question is for Dr. Farhad now. From your experience with patients going through end-stage kidney disease, what is the healthcare professional's perspective about end-stage kidney disease-related fatigue? And how do you manage this and support the patients both before and after kidney transplantation?
Okay, so thank you for this question. A patient who's on dialysis who's end-stage kidney failure, as I said, unfortunately, the kidney does, their kidney is not able to produce, to make sure that the body produces enough red cells, the vitamin D metabolism. So all of that is, it's affect their life, and it causes fatigue. There are medication, there are injections that while they're waiting or on the dialysis or waiting for a kidney transplant, they can receive that, and that will help the fatigue. I just want to bring another point. It's really different between an adult and a child. When a child is on dialysis, okay, like in a case of, I know Prithvik is a big boy, okay, the whole family gets disrupted, okay? The mother has to take a day off, or the father has to take a day off to bring them to the hospital, okay? And if they have any other kids, they don't have enough time to attend the other children. So it affects the whole family dynamics, okay? In case of adults, yes, they need someone to bring them to the hospital, bring them back. So really, the way forward is kidney transplantation. Hopefully, after kidney transplant, that person should not have fatigue, because now they have a functioning kidney that produces, help with vitamin D, with blood cell formation. So they shouldn't be fatigued, in fact. So it's a big change between before transplant and after transplant. And there are professional healthcare professionals, mainly nephrologists, before transplant and after transplant, who will make sure that this patients are doing really well.
Thank you for sharing that, Dr. Farhad. And we have another question coming in from Ms. Reem, and this question is directed towards Dr. Waldo. Can a person with chronic disease apply to register as a donor? And if that, in that case, can they apply to Hayat and donate, even if they have a chronic disease?
Great question, and the answer is yes, because the most important thing is to have the willingness. Now, I have been medical director of organization for many years. One of the aspects is that if let's say you have chronic disease, you have chronic diabetes, there are so many other things that we can do, in the sense that your heart may be working well, maybe your lungs, and tissue, and all the aspects that if you are already brain dead could help so much. So having a chronic disease should never be an impediment. It will be up to the clinical team of the organ procurement agency to make the right decisions for you. But that willingness and educating your family you want to be a donor, that's the important aspect. The rest is just what is possible according to your clinical condition.
It's great to hear that, and thank you, Dr. Waldo. Just the willingness and the fact that this is something that can be done even for someone with chronic disease just shows how much we can do even as healthy people in society. So thank you for sharing that. Our next question is from Ms. Hina, who asks, is it important for both the donor and recipient to have the same blood group? Perhaps Dr. Waldo could answer this as well.
Yes. So the short answer is yes. We want to be sure they have the same donor, but they can be also non-identical compatible. Like blood type O is universal, can donate to everybody, and even though they're not identical, they're compatible. So definitely it's about compatibility. Same will be the greatest, but also the O can donate to other aspects. We can also have to look at compatibility of the fingerprints of the immune system, called the human lymphocyte, leukocyte, and antigens. And there's a second layer of compatibility. But yes, blood type is important and is the first step.
Right. Well answered on that, Dr. Waldo. And I think that is something we talk about from a medical perspective, and making sure the blood group matches is quite important. Our next question is on the topic of permission and consent for organ donation. And the question is around the lines of, can organs be donated without permission or consent at any point? And I'm happy to have either Dr. Farhad or Dr. Waldo answer this.
Well, first of all, there has to be consent, some way consent. So we have a whole categories of consent. First line consent, that would be father to child, and go all the way down to sister and brother. If I can talk from the United States, let's say that there's an indigent person that essentially we cannot identify, the last resort is the judicial, the court, to give consent. But most of it, everything has to be done consent at all points, and there has to be a legal process to donate. In order, there's no question whatsoever that the process is legitimate, and we just did not snatch organs out of bodies.
Right. And again, this is an important question, and I'm glad this could be answered as well. We will take one last question, which comes from Mr. Nawaz, and the question is, if there are 3 or 4 any reasons for counting someone out as an eligible donor? Perhaps Dr. Farhad, if you could highlight these, and we can take comments from Dr. Waldo as well.
So we are talking about a kidney donor in this case. So yes, there are times that this person cannot donate, okay? We have to make sure that when someone donates, that they have enough kidney function to live a normal life. So if there is any reason, if they have diabetes or uncontrolled high blood pressure, that may affect their kidney function. And I want to inform everyone, the main cause of kidney failure in adults is diabetes and hypertension. So if someone has already that, we do not take that kidney. Also, there are other contraindications, like if a person has some kind of cancer, tumors, or they have some kind of infections, they cannot be donors. But we look at every patient, we assess them step by step, and it's a group decision. Where they will meet different physicians until they come and they pass through all the criteria.
So going to the area disease donor, we do exactly like Dr. Farhad mentioned. We look for, first of all, infection, cancer, diseases that involve organs, and high-risk behaviors that could transmit diseases to the recipient. Another important area that we always consider for donation is a social situation. If a patient, let's say, is 18 years old and wants to donate as a live donor, we will have significant amount of scrutiny to know that he understands very well and that we will not put that young man in a harm position with donation for his future. Same thing if you have a single parent and she wants to donate. Well, we always have to think who is going to support the child or the spouse when the surgery occurs. So it is not a mechanic type of process. It's also a psychosocial, dynamic process in which we try to, at all levels, we don't harm any side with a decision that was not well thought of.
Thank you, Dr. Waldo and Dr. Farhad. These are both valuable points as we consider patients for organ donation in the present and the future as well. As we come to a conclusion for this session, and again, I'd like to thank our panelists and Prithvik, Dr. Farhad, Dr. Waldo, Mr. Bhaskar, for your time and efforts in raising awareness on this important topic, and for making sure that organ donation can save lives in any part of the world. As we also move forward, I'd like to thank our partners, Mohammed bin Rashid University of Medicine and Health Sciences, Dubai Healthcare City, Al Jalila Children's Specialty Hospital, Mediclinic City Hospital, and Al Jalila Foundation as well. Thank you to anyone and all our audience members who came forward today and shared this hour with us. And we hope that this convinces you and helps you take a step towards saving lives through organ donation. Is there any other comment that any of our panelists would like to ask or add before we conclude the session?
If you have questions, get information. If you have any concerns, contact us. Don't be shy about it, because saving lives is our most important, valuable thing that we can do. Thank you.
Yeah, just do continue to save lives, and I hope this session has convinced you to truly give it a thought, to put organ donation on that pedestal and understand that we can live our lives even after death through other people.
Thank you. Thank you so much. And thank you to our audience members as well.
Thank you.
Thank you.